Good morning. I want us to look at the general nursing post-operative care you are going to give to the patient after general surgery. So under part 1 of our discussion, we are going to look at immediate care. And in part 2, we are going to look at subsequent care. So let's get started. So under post-operative care general immediate care, you are going to start by writing your aims. So the first aim or some of your aims you need to consider are the following. Number 1, to prevent or treat post-operative shock and other complications that might arise after surgery. Then to achieve the healing of a post-operative wound as quickly as possible, as well as to restore rapidly the functions of all organs of the body. So there are a lot of aims, but these are some of the aims you can consider under the post-op management. So from the aims, you move to correction of the patient from theatre. So after or upon receiving the call from theatre, you are going to go with a postop tray containing the following. So number 1, in your postop tray, there should be sterile oropharyngeal airway to maintain the patent airway or to keep the airway unoccluded. Then to make sure that you have sterile swabs or gauze to wipe away secretions, as well as to have tongue depressors to prevent the falling back of the tongue or to keep your tongue in proper shape. Then, after mentioning the post-op tray, you are going to talk or you are going to make sure that you discuss few things you are going to assess after reaching theatre. So, upon receiving theatre, as a nurse, you need to assess if the patient has recovered from theatre drugs. Very important. And second one, you need to make sure that you assess for spontaneous respirations by the using of your outside of your palm, feeling for the home breath. Then you are going to make sure that you assess the site of incision for fresh bleeding in case of reaction or hemorrhage or in case of slippery ligatures. Then from there, you are going to get your handover. So the handover you are going to get from the theatre nurse on blood loss and fluid therapy. Okay, so you are going to say, I will get a detailed handover from the theatre nurse on blood loss and fluid repressed. So also the handover on anesthesia and surgery, analgesics and other drugs which have been given during operation. Then you are going to say, after the handover is obtained from the patient with post-op orders clearly laid out for continuity of care, I will transfer the patient to the ward standing on the head side of the patient for easy observation. Then now you go to the transfer of the patient. Under transfer of the patient, you are going to say, I will transfer the patient to the ward on patient's trolley in the recumbent position with the head on sides to promote fluid drainage from the mouth. So this one is dependent with the type of operation which has been done. So take note of the position. Then from there, you make sure that you are standing on the head side of the patient for easy monitoring or close observation. Then the other things you need to consider in your immediate post-op care are the following. Number 1, environment. So under environment, I will nurse the patient near the sister's bay equipped with emergency drugs and resuscitative drugs and devices such as the oxygen machine for oxygen therapy and suctioning machine for suctioning. Then from there, you are also going to make sure that you position the patient in recovered position with a head on one side to promote drainage from the mouth. Then you make sure that the room is warm enough to prevent hypothermia since the patient is prone to hypothermia due to blood loss and exposure to coldness in theater. So make sure the patient or the room is warm enough. Then from there, make sure that your room is quiet to promote rest, and make sure that your room is clean to prevent cross infections. Then you move to maintenance of airway. So under maintenance of airway, here you are going to make sure that the airway is patent by positioning the patient in the recumbent position with the head on sides to promote drainage and prevent falling back of the tongue while the patient is under the effects of anesthesia. So this is very important because it will keep the airway patent. Then from there, you make sure that the head is hyper extended to facilitate free entry and escape of air. Then from there, you can also use sterile oropharyngeal airways, which can be inserted to prevent the tongue or epiglottis from falling back. Therefore, there will be no occlusion of the patient's airways. Then from there, in case of excess secretions, you need to suction them to keep the airway opened or patent. Then you move to maintenance of breathing patterns. So under maintenance of breathing patterns, you are going to say, I will observe the adequacy of breathing by observing the respiratory rate, observing for the presence of cyanosis, and use of pulse oximeter to check for oxygen circulation. So this is very important. So from there, you also check for any general signs of respiratory distress, such as sweating, use of axillary muscles of respiration, abdominal breathing, to determine if there will be need to administer prescribed amount of oxygen. So here, in case of any signs of respiratory distress, you need to administer prescribed amount of oxygen, therefore maintaining the normal breathing patterns. Then from there, you need to continue monitoring the oxygen levels for necessary intervention. From there, you move to maintenance of circulation. Under maintenance of circulation, you are going to say, I will quickly check for any signs of hypovolemic shock for necessary intervention. Example given is 0 or low BP and high pulse to prevent hypovolemic shock. Then from there, I will quickly also assess for patterns of IV line for continuation of fluid and blood administration. Very, very important. Then from there, you will also need to continue administering intravenous fluids for the replacing of lost fluids and the restoring of electrolytes imbalance. And therefore, you are helping to maintain normal blood volume, which is very important in restoring or in preventing hypovolemic shock or circulatory failure. Then from there, you need to use the fluid balance chart to monitor the patient's intake and output to avoid fluids overload or underload. So from there, you now move to drainage care. So remember, we are using the approach A, B, C, D. So under drainage care, here you need to make sure that you observe for the patient drainage for the amount, color, and consistency of drainage to detect any abnormalities. Very, very important. Observe the color, observe the amount, and the consistency of drainage to detect any abnormalities. Then from there, make sure that you empty the reservoir to at least 2 times a day, even if it's not full. So for the sake of measuring and for the sake of infection prevention, you need to empty the reservoir 2 times a day, even if it's not full. Then from there, you make sure that you change the dressing around the wound at least once a day, or more often if it comes soaked or dirty. This is necessary to prevent infection. Then from there, if necessary, you are going to say, I will milk the tubing or tubes every 4 hours to prevent the drains from getting clogged. Okay. Then in case of anything, you need to call the doctor in case the tube falls out or the stitches that hold it in place get loose. So two conditions: in case the tube falls out of position or in case the stitches that hold it in place get loose, you need to call the physician. Then from there, you move now to position. So under position here, the patient is placed in right or left lateral position, which is necessary in aiding or to facilitate drainage of secretion. So if the patient has any secretions, suction them using the suction machine in ensuring that the patient at the end of it all is comfortable. Then from positioning, you go to pain management. So under pain management here, you need to administer prescribed analgesics, for example, pethidine, 50 to 100 to relieve pain. So we know pethidine is analgesics, so you need to administer these analgesics, which are very, very important for the patient's survival. Remember, some patients can even go into shock due to excessive pain. Then apart from that, you can also provide diversional therapy. Anyway, it can be either watching TV if offered in order to divert recurrent attention from pain. Then ensure that the patient is comfortable in bed, as it may also help in reduction of pain. Then from there, you move now to observations. So under observation, you observe and record vital signs every 15 minutes or quarter hour for the first 2 hours. Then you move to 30 minutes or half hourly until the condition stabilizes. So take note, for the first 2 hours, observe every after 15 minutes. Then for the next 1 hour or 2 hours, observe vitals every 30 minutes. Very, very important. So any diversion from normal should be reported and necessary intervention taken into consideration. Then observe for and report any bleeding from a surgical wound. Then you need to also continue checking for active bleeding from the wound to determine any abnormalities such as cerebral ligature or reaction hemorrhage coming out as a result of other complications. Then any signs of infection such as pus or raised temperature are also observed for. Then you also need to make sure that you monitor blood reactions and if necessary, stop transfusion. Okay, so apart from that, you also need to make sure that you observe fluid intake and output to avoid fluid overload and dehydration or underload. Then observe for any signs of infection such as pus or raised temperatures should be taken into consideration. Then observe for pallor to rule out bleeding and make sure that you check the facial expression for pain. If necessary, administer painkillers or analgesics. Okay. So then from there, observe for urine output and input using the fluid balance chart to avoid underload or dehydration. Then observe for drainage, for color also, and the consistency. Then make sure that you also observe for pain and administer prescribed painkillers, for example, pethidine. Very, very important. Then the general condition is continuously observed for so as to prevent further complication. So this is where we end. You can add a lot of points where we've listed a few, but this is the general post-op you need to consider when writing post-op or in managing a patient from theatre under immediate care. So these points are very important and they will help you to manage a patient. So I'm Mr. DIBO. You can subscribe for more YouTube channel and watch out for part 2 as we are going to discuss subsequent care of managing a patient after surgery. Thank you very much.